Hello and a warm welcome to all of our Gold viewers here. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I'm very excited because we are here at Gold getting ready for our Labor and Delivery Symposium. And here with me today is Loredana Zordan, one of our speakers. Welcome, Loredana.
Thank you. Thank you for inviting me. Thank you
It's
very much.
wonderful to have you back here at Gold. Your presentation is titled Acupressure for Pain Relief in Labor. I'm so excited about learning more about this. But before we jump into this, tell our viewers a little bit about yourself. You are a midwife and acupuncturist and a teacher. So tell us a little bit about yourself at this point.
Yes, as I say, I'm a midwife, but I've always been, I did my training in UK, in England. And I've been a community midwife in UK. And just want to say that I've always been interested about complementary therapy, because I strongly believe that I like normal delivery, childbirth, to reduce the medicalization of childbirth. Not just an idea, how do I come across, am I interested about Chinese medicine? I was a student at university in Greenwich, was doing my master, and suddenly, I mean, there was during the, one of the lessons, there was this Chinese doctor, and we saw a video regarding was doing like an epidural. Sorry, they were doing a cesarean section with acupuncture. So it was very interesting that suddenly I thought, oh, I thought that Chinese medicine can be something that it can be used. And all starting from there, well, I mean, I interest. While I was in UK, I did my master on my dissertation master was on the use of acupuncture in obstetric. So I've always been interested. And then I did what was very interesting about my sort of training on acupuncture. I did my short 6 month training in UK, where it was like specific for acupuncturist. It was acupuncture in midwifery. And then I did my general, because I'm actually an acupuncturist, I did 4-year training in Italy. So yeah, an acupuncturist. And the problem, I mean, I'm just saying that to something from the which is going to give a perspective of how do I come across on acupressure in a way that in Italy, although because I'm not a doctor, I cannot use a needle. I cannot use acupuncture.
Right.
However, I strongly believe in acupressure, which is my sort of area of expertise. And I really like, it's not, I use acupressure because I cannot sort of use needle. I think that for some sort of, for instance, for pain relieving labor, which is my presentation, and for induction labor, is even more effective using acupressure than use needle. Because in a way, you know, women can mobilizing, they can self-administer the thing, the point, so it's more empowering.
Yes.
And since that, I started to Deborah Betts, which is an acupuncturist specific for, she's one of the best obstetric acupuncturists in the world. She came to Italy, she came to Italy and I did the acupressure with her. She did a training in acupressure. And since then, which I think is very important, I started teaching acupressure in Italy in many hospitals, in university, or even for private. And since then, more and more midwives are using it. And this is I think is very good. And when it comes my book, obviously, that is sort of
So you wrote a book. Show us the book. You have the book. The title of the book is?
Yes, Acupressure and Mox Sebastian. for childbirth.
Beautiful. For childbirth. Perfect. And that's
There is
available
a lot
on.
of picture with all the points.
Right. Perfect. So that's
Mhm.
fantastic. Yes. So
Yeah.
thank you for sharing that with us. And I loved what you said about acupressure, that it seems more accessible to you for our users, for families, for midwives, for and you mentioned something very important. The birthing woman can administer her own acupressure, or the partner can, or a doula or midwife can help with that. So it is very effective, as you mentioned, right? But you don't need any big equipment or any needles. And I agree with you, in many countries or states, and I'm here in the United States, you need a special license, or or in some countries you need to be a doctor to work with needles. So that it might be out of the question for many midwives or nurses or whoever is working in the field, but they're so passionate about natural birth and natural holistic pain relief. So this is a wonderful tool for anybody in the field to be using, right?
Yes, I think that is very important, because there is no sort of and it's very effective. Just to give an example, I'm talking
Yes.
about induction of labor, which is it's just like it can be used less syntocinon. And
Oxytocin,
then
yes, yeah.
syntocinon, and then the thing is that it can actually be shown. I think I strongly believe in Empower. Just to give an example, if we're talking about induction of labor, there is like a protocol, like you do 3 day preparation for induction. And obviously, in this case, you need to sort to tell the pattern to do it, and the woman need to know the point as well,
Okay.
in order to be effective. And for
Effective.
pain relief as well, is something that it can be used in early labor. It's good
Yeah.
for, like I say, for water birth. Um, yeah,
Wonderful.
I strongly believe in sort of this
So
empowerment.
it's
And
very
having said
effective.
that, I'm not saying that is a sort of a, but there are evidence-based that actually say that reduce the epidural and the cesarean section rate. It means
Yes.
something, that
Yes.
this is quite important.
Important. It's very effective, and there is
The less cesarean
evidence-based.
section, the better, obviously.
Yes,
For the
absolutely. And this
future.
evidence-based information. Also, just a quick correction. You meant with there is less the need of Pitocin, the use of synthetic Pitocin in for induction of labor. That's correct. That's what you meant. If that method,
Yeah.
the 3-day method, is being applied.
Yeah,
Fantastic.
and in the book is being sort of, I don't know said that until my book, but in the book is being some sort of, I explain the first part. I will explain a little bit of theory of Chinese medicine. I try to write in a simple way related to obstetric. You need to have a basic. But then as well, for the point of induction, it's like a manual. You get all the protocol, all the point that you've been using.
Right.
Obviously, I think that the book, I just want to say that the book is not only for midwife, but
But
it's for women as well.
for
Okay.
women as well.
Having said that, for certain point, for instance, if you have to sort of instruct the woman about the induction of labor, you need to be a midwife in a way.
Absolutely. You can't just do
Yeah.
that. And you should, and that's another question I had for you, contraindications or risks associated with you using acupressure points. There are, as you mentioned, points that, you don't want to push on because they could lead to preterm labor, or labor that is not not wanted at that time.
And another important thing is relating to the safety is just, for instance, just talking about induction of labor. It's very important that you don't use the point for induction of labor too early. Just for instance, if a woman want to ask you, I'm really fed up. I don't want
Yes,
to have a baby. My husband's not there, so I want to be, because it's like these points are effective.
Yeah.
So if you're inducing a woman, this is the basic principle. I strongly believe that in a way you should not induce medical induced women for no reason. There need to be a reason. And at the time, I think the induction rate in all over the world is seem to increase. So even with acupressure, you need to be careful, not use too early, because you're actually, your body is not ready. And there are quite strong effective point.
Right. Yes,
So just
absolutely.
wait.
Thank you for pointing that out. Just wait. Yes, definitely not not early. And we want to have as much time for the baby as possible in, in the womb and to be able to develop full term. Of course, that we should not take this lightly. And you will be talking about these risks in your presentation here at Gold as well. You will show us some beautiful points there that everybody can do, on themselves, and or the partner can facilitate on the birthing person. And you will talk in depth about the research and all, any adverse reactions or risks, and any points that we need to stay away from as well. Correct?
Yeah, yeah.
Absolutely.
Apart from that, it's
Absolutely.
safe if you're using that.
Safe.
It's a
Yes.
safe.
Loredana, before I let you go today, what are your final last words for our viewers? What are you hoping they will take away after watching your presentation?
Yes, I just wanted to say that work as a team. Okay,
Mm-hmm.
try to introduce acupressure in your whenever you work. And sir, don't be afraid of using it.
Mm-hmm.
As long as you got the women consents, obviously, and as I say before, if they know the point, doing the antenatal class, it will be better, because I strongly believe that information is important, labor
Yes.
preparation. However, I sort of encourage, because I'm just talking from my experience, I just want to give an example. I've been teaching so many midwives, and when they come from the same hospital, there's been one case, for instance, recently, one lady, she came to South Italy when I did my training, and then she went back to her hospital in the north of Italy, and actually the obstetrician were very sort of keen. They were so impressed because,
Mm-hmm.
the labor was working. There was one point where for OP position and for established labor, acupressure, and every time there is a sort of problem, they call her like an expert. So what I'm trying to say is just, I really want to emphasize that don't be scared, use it,
Mm-hmm.
use it.
Use it. Well, Loredana, thank you so much for being here with us today at Gold. And we are looking very much forward to your presentation that is going to be part of our Labor and Delivery Symposium. Thank you so very much.
Okay, thank you. Bye-bye to everybody. Ciao, ciao.
And some information now for our viewers, the Gold Labor and Delivery Symposium. You can find more information about that symposium. Go to goldlearning.com. We do have a live keynote presentation that is open access. You want to check that out as well. You'll find all the information on the website. Thank you, everyone, for watching, and have a lovely rest of your day. Bye-bye, everyone.